Welcome to the Dose of Good podcast, where we celebrate good people and organizations working to make the world a better place. It can be easy to get caught up in the bad things going on in the world and forget about the good happening all around us each and every day. I'm your host, Erin, and I want to share these stories with you and give them the attention they deserve. I hope this podcast educates and inspires you and maybe even motivates you to share a dose of good in your community. Now let's get into today's episode. Today I am speaking about the American Cancer Society. I speak with Mike Rollo, their government relations director, and Michelle, who is a volunteer and advocate. This is a little bit of a longer episode, but I hope that you will hang in there and listen to the whole thing because it is a wealth of information about the American Cancer Society, all the great work that they're doing, ways that they can help those who are fighting cancer, and just so much more that we covered that I hope you will set aside some time in your car or while you're cleaning your house and listen to the entire episode because I certainly got a lot out of it and I think that you will too. So now, let's get into it. Today I'm here with Michelle Lawrence, volunteer and advocate for the American Cancer Society Cancer Action Network, and Mike Rollo, Director of Government Relations. Thank you for joining me.
Thank you for having us.
We're really glad to be here.
So, Mike, what is the mission of the American Cancer Society?
Sure. So the mission of the American Cancer Society is to improve the lives of people with cancer and their families through advocacy, research, and patient support, and to ensure that everyone has an opportunity to prevent, detect, and treat and survive cancer, regardless of where you live or what you look like.
And how did each of you get involved with the organization?
So they were posting on Facebook asking people who had cancer and had used Medicaid in the state of New Hampshire. They were looking for people who had utilized the program to share their stories, and I volunteered and shared my story about how important Medicaid was to my own personal cancer journey.
Mm-hmm. And so, go ahead.
I was going to say, I started out as a volunteer also. I lost my dad, the first person I lost, well, maybe not even the first person I lost to cancer, but the most immediate family member that comes to mind was my father when I was 20. It was a colon cancer. So my mother and I were involved with Relay for Life, which is a fundraising effort of the American Cancer Society. And then many years later, a position came up for government relations work, which I was already doing. And it was just a natural fit. So it was. It's been very, very rewarding. It's been almost 14 years now since I've been on staff, but it's a very rewarding place to work, and our mission is just something that's very personal to me.
Well, that's good to know, and it's nice when your career can also be rewarding and benefiting others. So I think that's wonderful. So if others wished to get involved or volunteer, how can they go about doing that?
Sure. So we have sort of two different sides of the Cancer Society. We have what people think of as sort of the traditional American Cancer Society. They're the patient support services and fundraising. So if folks wanted to be involved with like our Road to Recovery program, where you can volunteer to drive people to treatments. Programs like that, or help with some of the fundraising, like I mentioned, the Relay for Life, or we have our Making Strides Against Breast Cancer walks coming up later this month. It's October, Breast Cancer Awareness Month. You can go to cancer.org, and there you can find a tab for what's happening in my community and look for New Hampshire and get involved that way. Michelle and I are both involved with the American Cancer Society Cancer Action Network, which I think we're going to get to in a second and what that is. But And we do the advocacy work of the Cancer Society. That's the other part of the mission, is to advocate for public policies that will benefit, cancer patients, their families, and help eliminate cancer as a public health issue across the country. And you can go to fightcancer.org for that, and then click on the New Hampshire tab. It'll say your state or my state. Click on that and follow down, and all of our contact information is there on how to get involved with the state issues. And I know we're going to talk more about what we do in the state, but that's the easiest way to do that.
I just want to say, too, one of the great things about the organization is that no matter what your ability, they can find a place where your strengths will be utilized. And so, for example, I wouldn't be the best at doing a Relay for Life event, but I can make phone calls and attend meetings and those type of things. And they're so helpful in making those opportunities for you as volunteers. And they're really supportive with their volunteers. It's not a, here, go do this, and then they leave you be. They're there the entire time, which is why I have really fallen in love with working with them.
That's great. Yeah, that's really good to know that they're, meeting people and finding where they can use their strengths, kind of thing. That's wonderful.
Well, thank you for that, Michelle. We try to make it make folks as comfortable as possible and play to their strengths. We would never ask any of our volunteers to do anything that they weren't comfortable with. Like Michelle is great at going and testifying before the legislature. Now, I know she was probably scared the first time, but she's a pro, and she was amazing the very first time she did it. But not everyone is willing to do that, so we have, and I know we'll probably talk about some more about different opportunities, but we want to meet you where you're at, and make it as pleasant and enjoyable as we can for you.
So it's not scary. Don't be afraid. Don't be afraid to call or reach out and click that button and say yes.
Yeah, that's great. That's good for people to know, because I know starting anything new can be a little bit intimidating, but it's nice to know that it sounds like it's a very welcoming environment and they really value their volunteers and everything. So since you had brought it up, the American, I want to get this right, Cancer Action Network is basically a different branch of the Cancer Society that works on government advocacy kind of stuff?
So we're the nonpartisan advocacy arm of the American Cancer Society, and we advocate for public health policies that will help eliminate cancer for all folks, regardless of where you live or what you look like. There are great health disparities across, even in our own state of New Hampshire, but across the country, and we help to try to eliminate those disparities and make cancer care accessible for all people.
That's great. Now, sticking with that subject, so you both were involved with having efforts to get Medicaid expansion in New Hampshire. Could you tell us a little more about that?
Sure. Let me just tee it up, and then Michelle, who is truly our star for reauthorization this time around. ACS CAN was involved with the fight, and it was a fight at first, to get Medicaid expansion authorized in the first place. For those that may not be aware, under the Affordable Care Act, states were given the opportunity to expand their Medicaid program to cover people that wouldn't traditionally be covered under Medicaid. These are folks that fall into this sort of coverage gap, we call it, that they don't meet the traditional requirements of Medicaid, but aren't old enough to get Medicare. They have there are certain income requirements that go along with it, but we thought it was important that the state take advantage of the federal funding that went along with this to expand health insurance access for people, because we know that when folks have access to care, whether it's preventative screenings, those sort of things, and then if God forbid, you do get a cancer diagnosis, you have access to treatment. You have options besides going to the emergency room, and that's how you find out you have cancer, which unfortunately was happening. And it may still happen, but we have more options now. So we were involved with the effort to get Medicaid expansion brought to the state, and then I think when Michelle was involved, it was our third or fourth time of reauthorizing the program. New Hampshire decided, unlike most states, because we like to do things a little differently in New Hampshire, that most states would just authorize the program and that's it. New Hampshire said, no, we're going to make sure it's still working, making sure it's cost effective, all of that. So we were going to reauthorize it every 2 years at first, which if you're a provider is scary because you don't know if you're expanding programs, you're hiring staff. Well, will the money be there? You've brought your facilities and expanded, hired staff, all of that. And it's not just for cancer care; it's for a whole host of healthcare options. But then the legislature said, okay, well, maybe 2 years is not, and it's not good for patients. And that's what we always think about at the Cancer Society first and foremost. You don't need the stress of wondering whether or not you are going to still have insurance coverage every other year. So the legislature then decided, well, maybe every 5 years, which was a little more manageable. And then fast forward to, was it just a year or 2 years ago, I guess at this point, they said 7 years. We were very close to getting them just to reauthorize it permanently. That was a bridge too far for the House of Representatives. So they said 7 years. So I think eventually, as we prove that this program actually saves the state money in the long run because people are healthier, it brings in millions of dollars of federal funding that would go to a different state if we didn't take advantage of it. That it's a win-win for the state in general. And then when we were reauthorizing this last time around, we really needed to show. Not so much the Senate, it passed unanimously in the Senate for reauthorized permanently, actually. We needed to be able to show legislators that this is affecting real people in the state of New Hampshire. These are working folks that, by no fault of their own, may have jobs that don't provide health insurance. And so they need some help. And we needed to be able to show the legislature that, as I said, it affects their constituents, and from across the healthcare spectrum. Quite a few of the folks that were coming forward to talk about the reason why they wanted to see the Medicaid program expansion program continue were coming from the substance misuse community. And in the heights of the opioid crisis in New Hampshire, expanding Medicaid was a real lifeline. And so, but legislators were getting, I hate to say this, but it sounds very callous, but they were getting tired of just hearing from the same sort of people. And they needed to hear more. We knew that it was affecting cancer patients also positively. And so we said, well, we need to try to find more of those voices. And then we were very fortunate to find Michelle, who was truly, she's not going to say it, so I'm going to say it for her before she gets to tell her story, was the rock star of this campaign. I can't tell you how many legislators, actually just immediately after the hearings were over, came up to me and to Michelle and thanked her for sharing her story. Because they needed diversity, and they needed to hear, how it was affecting other people in the state, not just from one community. So I'll let Michelle tell the story, but she was a rock star. She was people. I've never experienced it in a hearing where a member would stop the hearing just to thank someone we're going to testify. It doesn't usually happen. So Michelle, go ahead.
Thank you. What he isn't telling you is that he was there right next to me, supporting me the entire time, and so wasn't Emily. So there was, once again, they never leave you all by yourself. They're always there right behind you when you're volunteering, which is great. I stepped forward to share my story, which just kind of in a nutshell is I have chronic cancer. It's not curable. I had lost my job, which meant I had lost my health insurance. And right now, I'm in palliative care, and so treatment is imperative in order to keep me alive, basically. And I was panicked, and I applied for Medicaid and was accepted. And it was and is a literal lifesaver because I was not in an economic place where I could afford any of the private health insurances that are on the market. I support myself financially, and so it was a huge sigh of relief because it meant that I could continue to accept treatment and get my needs, medical needs met without interruption. And I actually got stronger and healthier because I wasn't worried about, will my insurance cover this? Will I have to pay insurance premiums or rent? Or those type of tough decisions a lot of cancer patients have to make. I was, for the first time in 15 years, able to focus just on my treatment and my diagnosis, which was a breath of fresh air. And I'm ever so grateful for Medicaid and the services that it provides.
Yeah. Well, thank you for sharing that, and I'm glad that this was a success for you, even though they didn't approve it for indefinitely, at least that 7 years, because yeah, that would be just an added stress to patients to have to, oh, okay, I have it now, but will I have it in a year, kind of
Right.
thing. So it's thank you to you for helping make that happen for people. And
Anytime.
while on the subject of kind of legislation, is there anything else going on in New Hampshire or Washington that people should be aware of?
There are. We have a lot that we're doing, actually.
Okay.
In Concord, we're working on a number of bills. We're sort of getting ready for the session that's going to start get through the election first in another month.
Right,
But
yeah.
we need to. We're gearing up to work on a few campaigns next legislative session. It's a budget year, so that's always a big deal for us. We're going to be working to protect funding for the State Tobacco Control Program, the Cancer Registry, the Office of Rural Health, which helps with access issues for the vast majority of our state, which is more rural. Maybe not this part of the southern part of the state, but go north of Concord, and it's a whole different story. And for the breast and cervical cancer early detection program. On top of that, that could just be a full-time job just trying to work on the state budget. But on top of that, we're also working on two pieces of legislation. One is to expand access to biomarker testing, which is really important to the new way that we're treating cancer. In the old days, you would have, and some people still get this, but we think of traditional chemotherapy as sort of this just a drip, where you go to the infusion center and you get a lot of poison put into your body, basically, and we hoped that that's trying to kill the cancer cells doesn't, and I hate to say it this way, but doesn't kill you first. I mean, and it's tough. So the new therapies that are being developed are much more targeted. But to get to that treatment, to get to the targeted therapies, there needs to be testing to see if you're a candidate for that. And that's biomarker testing, where they take your tissue, and they see if you're a candidate for a whole host of different types of treatment options. And if you're not, then you may have to go through that sort of traditional, what we think of more as the old-fashioned way of fighting cancer. And also, it's both insurance reforms. So there's that one. It doesn't seem, they're not exciting and sort of sexy issues, but they're really important to people that are going through treatment or fighting cancer. Another one's called, we're trying to eliminate an insurance practice called copay accumulators. We came very close to defeating it, or to passing it, and defeating this practice this past year, and the House just wouldn't go along with it. We're hoping that's not the case next year. But basically, insurance companies can use a practice to say that if you get help, you go, let's just say, back up. It's sort of a complicated process, but it's really important. God forbid you go to the doctor, you get a cancer diagnosis, and they say, okay, well, good news is we have a therapy that will treat this for you. Bad news is it's very expensive. You've got a $500 copay, let's say, for instance, because I like round numbers and I'm not the best at math. But the good news is there are charitable foundations either run by the pharmaceutical companies themselves. Sometimes there are a number of those companies that have charitable foundations as part of their companies. There could be just private charitable foundations. It could be your church. It could be as simple as a GoFundMe in some cases. Okay, great. You're going to get, let's say, $400 in charitable foundation aid. It's usually not that high, but let's just say it is. Great. You go to the pharmacy, you still owe $100. You pay it, terrific. The insurance companies, then you get your medicine, you go on your way, and hopefully this is helping you in the way you need to be helped. The insurance companies currently can say, in New Hampshire anyways, that, great, well, that $100 you paid out of pocket counts towards your maximum out-of-pocket cost per year. Try not to get too far into the weeds for your listeners, but it's an important issue we're working on. But that $400 worth of help that you got, that doesn't count. You're still on the hook. You have to make that up at the end of the year. Well, we say, well, what difference does it make? Who's paying for it? As long as it's getting paid, you get what you need. The companies that your carrier, your insurance company, is getting their share. What difference does it make who's paying it? Well, they do, apparently. So this is a practice that's been prohibited in 19 other states. Actually, the number may have gone up since then, but the last time I checked it was 19. So we'd like New Hampshire to join those ranks. I believe we're the only state left in New England without this. I work in New Hampshire and in Vermont, and Vermont passed it this session, this past year, and New Hampshire came very close. And in Washington, because we also do work down in Washington, we're looking to increase funding for cancer research. We're always, as a sort of a perennial ask for us to the federal government, and to increase funding for prevention programs like the breast and cervical cancer early detection program that I had mentioned. The state pays for part of it, but the overwhelming majority of the funding for that program comes from the federal government, and for all the states. And we're working on another bill. We're working on several bills, but one that's that comes to mind, and that's we're very, very close to getting passed, is the Multi-Cancer Early Detection Screening Act, which is a mouthful. I know. We love acronyms at the Cancer Society, so it's the MCED Act. And it's basically these multi-cancer early detection tests they're very close to coming to market, but there's none that's gained FDA approval yet. They're very, very close. Basically, these are blood tests that can, some of them can test for up to 20 cancers that we don't have tests for currently, and I've seen one that was up to 50. Now, this is to complement the 5 existing screenings that we have. So we can do PSA, which is prostate, mammograms for breast, lung cancer screenings, and Pap smears for cervical cancers. Those are the only 5 tests that we have currently. to screen for cancer. So this is a game changer. Once these come to FDA approval and come to market, and we're told that should be as early as January, February of next year, that these tests will finally be. We've been working on this legislation for a while, but basically it gives the Center for Medicaid and Medicare Services, CMS, the authority to, once these tests come to market and they've been proven to be medically effective, that they will be able to start offering it to those that are on the Medicare program. If not, we'll have to wait and go through the very lengthy process of getting the individual tests approved. This is the first time we've ever gone this route, and we learned the hard way through lung cancer screenings, mammograms, all the ones that I've listed. They're now covered by Medicare, but it took a very long time to get there, and Medicaid rather, I should say, for some of the tests. But we don't want people to have to. We don't want people to have to wait once these tests are available. Because, as I said, the fact that we could test for up to 20 or 50 cancers that we don't currently have screenings for, it's a game changer. It's almost like science fiction come to life, and it will certainly be a game changer for the treatment for cancer, and we want to make sure that we're ready to go on day one.
So how would that work for people? Would it be if you're predisposed to cancer, you would get these blood tests? Would they just be giving them to anyone of a certain age?
Well, see, that would be so. No, it wouldn't be for anyone of a certain age. It would be anyone that would qualify for Medicare. So anyone 65 and older. We'll start there.
Okay.
There's sort of a saying in the insurance world: as goes Medicare, typically as goes private insurance.
Oh, okay.
Doesn't always work that way, but it does tend to trend that way.
Okay.
In that, there would be certain requirements. You'd have to be a Medicare enrollee to qualify for it, and then actually the not to get too far into the weeds, but the bill it's made it through out of the House, U.S. House of Representatives Ways and Means Committee that passed unanimously, and now going to the Energy and Commerce Committee. There were certain requirements where they would start at for 1 year, so those of a certain age would qualify, and they would sort of tick up until all enrollees would be covered over a course of, it was like 5 or 6 years.
Okay.
So they wouldn't do it all at once, but as a cost savings, I believe. But in the long run, these tests would save money. I mean, they've found, and that's why the Ways and Means Committee, the people that are in charge of doling out or figuring out how much money the government has and how to spend it, they passed it unanimously because they saw that it would actually save the government money in the long run, because we'd be able to treat cancer earlier. When you're diagnosed at an earlier stage, it's much easier to treat in many cases. Mm-hmm. Not always, but it's better for the patient, and it's better for the health system overall because there's less resources that have to be used. Mm-hmm. That's why we advocate for early screening, and often to make sure that if you are going to be diagnosed with a cancer, that we can catch it at the earliest stage possible. Mm-hmm. Because overall you have typically better outcomes if we can.
Yeah. Well, I appreciate you sharing all that, because I know I wasn't aware of all that going on, and I'm sure unless people know to look for it, they may not be, and it's definitely important stuff that you're working on, so thank you for that. Just to go back a little bit to some of our more general questions, what is the most common type of cancer?
So we have a few in New Hampshire, and actually it's across the country, but in New Hampshire, it's prostate cancer first, and then breast cancer, then lung cancer, followed by colon cancer. And that tends to be the trend across the country.
Okay.
But those not necessarily in that order, but in New Hampshire, that's the order of that they fall into, and that there are going to be approximately 9,880 new cases of cancer diagnosed just in New Hampshire
Yeah.
in 2024. And unfortunately, in this year also, there's going to be approximately 2,930 deaths from cancer. So whatever we can do to help prevent and make sure that number goes down. I can tell you that the new diagnosis has only gone up since I've started my years working for the Cancer Society. But we in New Hampshire, we may be finding more cancers, but we're doing a better job of screening for it. And our mortality rate in New Hampshire is lower than in a lot of other states because we have such high screening rates.
Okay.
So that's a positive. I mean, there's still almost 3,000 people that won't be here by the end of the year. We'd like to get that number down as close to zero as possible. But
Yeah.
it's a struggle that continues year after year.
Yeah.
And what I appreciate about the American Cancer Society is that you guys are working on a macro and a micro level. And so it's not just about providing patient services like rides in places to stay and whatnot. It's also investing in research and changing legislation to make sure that it meets the needs of cancer patients in the future.
Yeah, I mean, we as I mentioned before, we advocate for federal funding for cancer research. The U.S. government is the number one funder of cancer research in the country. They're the largest. The second largest is the American Cancer Society itself.
Yep.
We are the largest non-governmental funder of research in the country for cancer. We're very proud that we have funded. We typically try to fund researchers at the sort of the beginning of their cancer research, and the federal government doesn't typically focus on those folks. We have we're very proud of the fact that we've actually funded 49 Nobel laureates at the beginning of their careers. So we've helped them stay in the game because that's what we're finding a lot, that a lot of younger researchers are getting discouraged because the funding isn't there, and they leave. They go to and they take their talents elsewhere. They don't focus on cancer research, and is that the next big breakthrough that we're missing because that person didn't stay in research. So that's why we try to typically focus on the newer, younger researchers.
Is there a reason that you have been given as to why maybe cancer? So the screening is helping you find more people, but is there anything they can pinpoint that's causing any of this? And then the second part to my question would be, what can each individual person do, if anything, to prevent cancer?
Sure. So let's try to take the first part first. There are a number of reasons why someone may be diagnosed with cancer. There could be their personal habits. They could be tobacco users. The number one preventable way of not getting cancer is not to use tobacco, actually. And we've been working on that for a very long time. We've actually saw cancer rates drop because of all of the work we did in the 20th century. We were watching cancer rates escalate upwards in the 20th century, and a lot of that was due to tobacco use. So we put a lot of effort into trying to educate people and passing laws to help curb tobacco use. And we started to see a decline in cancer rates rapidly, actually. And we're still seeing that. Unfortunately, though, now we are seeing a lot of younger people being diagnosed earlier than they would have been That could be a number of factors, environmental issues. I know in this part of the state, we're seeing a lot of issues with PFAS in the water, and that has a connection to certain types of cancers. But people still smoke. People still use tobacco, so we see that. But there's also genetics. People could just be predisposed to certain types of cancers. So there's genetic testing that can be done to see, and then there's a course of issues, options for those folks if they're found to carry certain genes. But there's also diet and exercise play a big part. So there's no one answer.
Sure.
Unfortunately, I guess that's my point. There's
Yeah.
there's no one answer as to what. And cancer's not one disease. It's
Right.
hundreds of different diseases that that fall under the sort of umbrella of cancer. So there's no sort of easy answer to your first part. To your second part, you had to remind me exactly because I've
I
gone
think
off
you
on-
kind of covered both because it was why there might be a rise, but then what people could do to prevent it, and you've kind of gone over a lot of those
So yeah,
things.
preventative screenings are very important. Very important. That's why we advocate for more funding for public programs for those that may not have insurance. Still, there are still people that aren't insured as much as we've been trying to expand access to coverage. But there's also people that are underinsured. They fall into certain coverage gaps. So there are programs to help there. But if you have insurance, we want you to get screened. That's very important, very, very important for the 5 different types of cancers that we have screenings for. If you are in certain categories, you should be getting screened. But also, like I said, diet and exercise and not using tobacco. That's the number one way you can prevent a cancer from developing. It's not getting started in tobacco. And if you are using currently, there are, you're addicted to tobacco, to nicotine, we know how hard it can be, but there are options out there for you. And we want to make sure that you have access to those. And we're willing to help provide the information as where we can access, whether it's through private insurance or the state quit line that we advocate for funding for. So there are options for you, but we want you to get healthy and hopefully not develop a cancer.
Yes.
And tobacco doesn't just impact the user, it impacts the people around you as well due to secondhand smoke. So
Right.
quitting, you're not just doing it for yourself, you're doing it for the people around you as well.
Right. Yeah. So could you talk about some of the services offered? You touched a little on like giving people rides if they need it. And what is the helpline and the Hope Lodge, if you could get into some of those programs?
Sure. So our Hope Lodge program is actually very exciting for me personally. I know because my family actually took advantage of this before. Actually, we think it was either just before or maybe just after I became an employee of the American Cancer Society. My stepdad was diagnosed with multiple myeloma and had to receive his treatment. He was also, I shouldn't laugh now because he's okay.
Oh.
But it's not funny, but I mean, it's sort of just ironic that, so he was actually, they found out they had multiple myeloma because he was going in for a kidney transplant.
Oh, wow.
And either the day before or 2 days before, he was going through one final screening to get his kidney transplant rather. And they said, sorry, sir, we have some more complications for you. You actually have multiple myeloma. That's why your blood counts are so low. And he's like, what?
Oh,
So he had to fight that first. And that meant a lot of time in Boston, weeks on end, going through a lot of different treatments and things. And my mom, she lives an hour and a half away or so from Boston. So it really wasn't feasible for her to be driving back and forth every day. So Hope Lodge, we have them in a number of locations. The closest one for us here is in Boston. Basically, it's a place where cancer patients and a caregiver, one person, can stay with them free of charge. very close to the cancer centers in Boston, anyways. If not, there are services where we will give you a ride to your treatments too from there. But it's a free place for people to stay, so they don't have to worry about how they're going to afford to. I mean, there was no way my family was going to be able to afford for my mother to stay 7 days a week. It was an entire month actually in Boston. I mean, that's I don't remember how much it was then, but it's a lot of money to stay every night, even in the most, maybe they're not the most desirable hotel in the city. It's expensive. So it's a place where folks can go and get and stay. But there's also a community there too. There's kitchens where you can go, you can buy your food, and you have your own little locker. You can put your stuff in there. But people will come in, different companies, volunteers will come in and provide communal meals for people. It's an amazing service, actually, that we provide for people. And we actually have one in Burlington, Vermont, also. So there's 2 in New England. But there are other programs. We do the Road to Recovery program, which is where we have volunteers come and they drive people to treatment. So you're not necessarily someone that needs to be in Boston. You could be someone who lives in Londonderry who needs to get to Manchester.
Okay.
To receive treatment. Although I think there's one in Londonderry now too, so maybe you need a ride here. But you don't have someone that can take time off from work, or you don't have anybody else in your life that can help you. Well, we have volunteers that will drive you to your treatment and back home. We have other support programs that are volunteer led. That help people feel a little normal again. I hate to use the word normal, but just to feel like themselves again, I guess is what I should say. You're going through chemotherapy and you're a woman and you don't know, you like to wear makeup. Well, your skin reacts differently now. You don't look like yourself anymore.
They'll look good, feel better.
Right, look good, feel better. Sorry, I was drawing a blank. Thank you, Michelle. We have these programs. We will provide a voucher for you to get a wig. If you've lost your hair and you want to get a wig, we'll provide you a voucher to help pay for that. So there are things like that we do. I don't want to monopolize the entire conversation. If you want to add, you've been through this yourself. I don't know if you took advantage of any of that.
Yes, I did. I did the Look Good, Feel Better, and it's about empowering people when you feel like you look good, right?
Oh, yeah.
And you're having a cute day.
Sure,
right?
yeah.
You feel better about yourself, and cancer can take a lot of things from you, including your self-confidence, and because there's so many changes to your body. But they have this great program that shows you like all these tips and tricks on how to kind of get not back to your normal self, but to a place where you're comfortable. And the wig vouchers are huge. Losing hair for a lot of people is really hard, and the wigs are expensive. And so covering that socioeconomic barrier for a lot of people makes a big difference. And that can be the difference of someone being willing to apply for a job or go into office, versus stay at home and not do anything.
Yeah. Yeah, no, that's good to know they offer that, because I wasn't aware of that. And that's something that's not maybe huge, but makes a huge impact to people. Are there like support groups or anything like that for people who maybe are going through cancer and just want to be with other people who understand what they're going through? Or
There it all depends on where you're at.
okay.
In the country.
Okay.
Even in New Hampshire. So I would encourage people to go to cancer.org.
Okay.
And go to the New Hampshire specific page where they can get more information on what's available in their community. Because it really does vary.
Sure.
From community to community.
Okay.
We have scale back a little bit on some of those programs in the way that we focus on them. We still provide support in certain communities, though. But we found actually just before COVID. Actually, I don't like to blame everything on COVID.
Sure,
but,
yeah.
it did have a big impact. COVID had a big impact
yeah.
on how we delivered our mission. But even before pre-COVID, it's hard to remember those days. We were finding that we could have a larger impact by focusing some more of our attention on research.
Okay.
And focusing that way, because there are a number of other nonprofits across the country that focus on some of these more direct outreach groups, that sort of thing, and that we could, and they were doing great work in different communities, and that we could have a larger impact on the more global fight against cancer. If we focused on research, and so we made a little bit of a shift before just before COVID, and then when COVID started, a lot of the programs that we still had were put on hiatus, and not all of them are back yet. So I don't want to speak to and say,
Sure,
oh, well, you
yeah.
can get this program.
Oh, no, that's
because everything it really depends on where you're at in the country.
Okay, well,
So
that's
if you
good.
go
They
there,
can go to the
you'll get
website and
better
find out for
information, yeah.
themselves. Okay, that's good. You mentioned some of the fundraisers and things that you do. Like, this is Breast Cancer Awareness Month, so they have, I believe it's a walk for that.
We do. We have our Making Strides Against Breast Cancer walk. We have 2 in the state of New Hampshire.
Okay.
On October 20th, it's going to be in Exeter. And on October 27th, it's in Concord. Concord, New Hampshire actually has the largest per capita Making Strides Against Breast Cancer community walk in the country.
Oh, wow.
Yeah, it's hard to believe that it's in Concord,
Yeah.
of all places. I mean, now there are larger ones, obviously, in New York City and in Boston.
Sure.
But based on the population, we actually have the largest walk in the country.
Wow.
And they do a great job up there for raising money for breast cancer awareness and for research. The money that goes to that walk, that money is specifically for breast cancer research
Okay.
and programs. But that's on the 27th, and you can find more information again if you go to cancer.org.
Okay.
You can get all the details if you want to get involved with the walk. There's still time. You've got plenty of time before the 20th or 27th. And then in the spring and in the early summer, we have our Relay for Life,
Okay.
which is also, depending on where you live, it used to be a 24-hour relay where people would walk around like a
okay.
track. Like you think about here at Londonderry High School, you've got a track where
Yeah.
they do track and field. Well, we would come, and actually, I think Londonderry is actually one of the largest ones in the state, actually.
Oh, okay.
Actually, I think that actually, if it doesn't still happen here at the high school, it used to go between Pinkerton and Londonderry High. I
Okay.
know there's a big rivalry.
Yes,
so.
yes.
But and at one time they used to have their own, but I'm not sure if they still do or not. But if you go to cancer.org again,
Okay.
you can see which again, I hate to blame everything on COVID, but COVID did a number on
Well, yeah, it
on
was
what's
hard
still
to do
left,
any of- yeah.
right?
There's also some digital fundraising you can do. So right now there's it's a photo a day in October where you post a photo on your social media accounts and you tag the American Cancer Society and post your link, asking for funds. I'm doing that one this month. Next month is Knitting in November, another digital online fundraiser where you'll be knitting and showing what you're doing and posting pictures and encouraging people to donate. So again, all different levels of opportunities for folks.
Yeah, that's neat, and that's kind of fun the way they're doing it with a photo or knitting. So
Yeah.
it kind of is things you're either doing every day, or with the photo, you can get creative with it, that kind of thing.
Yeah, they
So-
provide checklists for inspiration. They send you in the morning a little prompt if you need one.
Oh, nice.
It's really, I know it's only the beginning of October, but I'm already having a blast with it.
That's awesome. Yeah, I'm going to go look for that, look for the little tag and see what that's all about. That's fun. Is there anything we haven't covered? I know we've covered a lot, and I appreciate that, but is there anything we haven't talked about that you'd like to make sure people know?
Well, first of all, I want to say thank you for providing us the opportunity to help raise awareness, because I think that's also part of the. I know that's part of our mission. I mean, it's an important part of our mission is to raise awareness. There was a time not all that long ago where people didn't say the word cancer out loud.
Right.
I'm old enough to remember family members, they would talk about aunts or uncles and brothers and sisters would be diagnosed with cancer, and they would whisper it. I mean, it was not something that you talked about. And we want to make sure that's not the case anymore. We want people to talk about it. We want to raise awareness. We want people to get screened.
Yeah.
And if what we've talked about today interests you, if there's things that you want to get more involved with, there are ways to do it. And we would encourage you to get more involved. And we'll meet you where you're at. If you want to do the sort of more patient-centered stuff that we've been talking about just now, or some of the fundraising, there's also fundraising for ACS CAN, and we do that as well. But if you want to focus on the non-advocacy side of the Cancer Society, you would go to cancer.org. That's the easiest way to do it. All of the contact information for the different parts of our world of the Cancer Society are there. If you want to get more involved with advocacy in New Hampshire, or if you've got someone you're sharing this with out of state, you can go to fightcancer.org. Click on the little tab at the top of the screen that says My State, and you can see what's going on across the country, or and even down in Washington. But we would encourage you to get more involved. I don't know, this is not hyperbole, I don't know a single family that has not been touched by cancer in this state. I have personally lost my dad, as I mentioned. I've lost 2 aunts. I've lost 2 sets of grandparents. I mean, this is to different types of cancers, uncles. This is a disease that affects every family in the state of New Hampshire, but unfortunately, and I guess we didn't talk a lot about this, it doesn't affect every family equally, and that's why we advocate for the policies that we do. It shouldn't depend on your race, your sexual orientation, where you live. If you live in a rural community, whether or not you have access to cancer treatment and preventative screenings. But there are barriers, real barriers that people face in accessing treatment care, cancer treatment. And we want to make sure we take down those barriers. So, or insurance barriers, as we've talked about a lot today. And if any of that sounds like something you want to help us take on, whether it's just clicking on yes on a petition, or writing to your legislator, or making a phone call, or coming with us to share your story before folks in Concord. Whatever you're most comfortable with, we'll meet you where you're at. I would encourage you to go to fightcancer.org, click on the New Hampshire tab, and learn a little more about what we do and join our fight, because it truly takes a village, and we are a nonpartisan organization. We work with both sides of the political aisle, and we have allies of all political stripes across the country. It's not just New Hampshire. We do this in all 50 states, but we need you. We need your voice to get involved.
Sure.
So.
And I want people to remember, especially cancer patients, that you're not alone, that there is community out there. And sometimes it might take a little bit of digging to find others, but a great place to start is cancer.org. And you're not alone. There's people who've gone through this that can help, and sharing your story is powerful. it's a way to take something that has not been the best and use it to do good for others.
Thank you for that. And so the last two questions I like to ask everybody, the first being, which nonprofit you think we should feature next?
So I thought it would be appropriate, where October is Breast Cancer Awareness Month, to feature the Mike, can you?
Sure. It's the New Hampshire Breast Cancer Coalition.
Okay.
Yeah. And they offer all different kinds of services to patients. Their website is nhbcc.org. And I've had a few friends that have used the organization and found it very beneficial. And it's a great way to honor folks in the month of October.
Yeah,
To
definitely.
feature
Yeah,
an organization like that.
I appreciate that, because as I had said before we began the podcast, I'm just learning that there's so many organizations out there doing great work that I never even knew existed, and here's another one I haven't heard of that I'll definitely reach out to. So thank you.
Yeah, we've partnered with the New Hampshire Breast Cancer Coalition for years. I personally have partnered with them on a number of initiatives that we've worked on in Concord, whether it's expanding access to breast cancer screenings, the Medicaid Expansion. They've been a great ally too, because much like us, they want people to get screened, and if God forbid they get a diagnosis, they want them to have access to treatment also.
Mm-hmm.
But yeah, no, they're a wonderful organization that has been fighting the good fight in New Hampshire for, I can't remember, I think it might be up to 30 years now. It could be 40 years. They've been around for a while too. Maybe not as long as the American Cancer Society, but they do a great work. So.
Okay. Well, thank you for that. Was there anyone else you want to mention, or just you don't have
I mean,
to? That's
there's
good.
another organization that's not actually has nothing to do with healthcare. Actually.
Oh, it doesn't have to. It can be anything.
But there's the New Hampshire Preservation Alliance. Does amazing work in helping preserve special places in New Hampshire that make New Hampshire New Hampshire, through helping to save public spaces with they're actually going to be publishing their 7 to Save list. They do this every October, and a passion of mine is actually outside of work.
Yeah.
Because I it's good to have things outside of work
Oh,
too.
sure.
It's historic preservation, and they'll help individuals and communities help preserve and protect special buildings, special sites that make New Hampshire New Hampshire. And so they go fly under the radar a lot, I think, sometimes, especially in October, because we tend to eclipse a lot of what the work we do.
Yeah.
The Cancer Society eclipses a lot of, and like the Breast Cancer Coalition, because it's Breast Cancer Awareness Month, which is incredibly important. I've had too many family members hear the words that you have breast cancer. So I don't want to take anything away from that. But this is another organization that does a lot of great work and highlights it in October. So if you wanted to talk to them, they're local. They're a New Hampshire charity that does great work.
Yeah, I appreciate you mentioned, because that's, again, another one I wasn't aware of, and that's
I bet you they have done a lot of work in helping to preserve places in Londonderry that
I'm sure.
you go
There's a
by
lot
every
of-
day. You're like,
Yes.
I can't believe we've considered tearing that building down once, or that beautiful field or vista or whatever that everyone in town enjoys. Like, oh, why do we still have that? Well, it might be because of the work, the
Yeah.
advocacy of that organization, and helping to show people within their community how to do things for themselves. So
Yeah,
it's just
I'll
another
definitely
thing to
look
look at.
into. Yeah, thank you.
Sure.
And then the last thing I know is a difficult one, especially just to pinpoint one thing, but you can take time to think if you need to. But what is the kindest thing you've witnessed or been a part of?
So I really appreciate the premise of paying it forward. I have witnessed a lot of situations where that's come into play. And I think one of the most touching for me is I was at the grocery store, not in the best headspace, because who wants to go grocery shopping? And I was, bless
Sorry.
you, I was in line and kind of being a little impatient. I'll admit that. And the woman that was checking out was older and was counting out her money as they were carefully ringing items through. She had a budget that she needed to stay on. Well, she didn't have enough to cover everything that she needed. So the gentleman that was next to her, who had no relation, just without missing a beat, opened his wallet, took out his card, and paid for the rest of her groceries for that day.
Yeah.
And I still get a little choked up because she was ecstatic and so relieved. You could see the tension melt away from her shoulders. She was trying to make those hard decisions, what do I absolutely need? And he said, it's okay, today's okay, and took care of her. And I think moments like those are really powerful.
I would agree, and thank you for sharing that, because I love hearing those stories, because it's those small acts of kindness and those small gestures that can totally, make a huge impact on somebody's day, even their life.
Yep.
And I think it's those little things happening every day that you don't always hear about, but are going on all the time from everyday people just going about their life. And I think those little things add up to big things and really do make the world a better place. So,
I agree. And that's why I always encourage people to engage in those, moments if they can. Have a couple of spare gift cards on you, or, add it into your budget, or
Yeah.
even cards of inspiration. Maybe someone's having a really tough day and they find a lovely note in the store that
Yeah.
just picks up their mood. I mean, there's just so many different ways that you can make a big impact
Yeah.
by doing something small.
Yeah, definitely. Did you have something you want to share?
It's hard to
I
top that
know.
one. I don't know if I have just one in particular, but I'm very blessed that I get to work with some amazing volunteers, and I have over the course of my time at the Cancer Society, and I just get to see them in action. I think that's a great gift for me to see folks in action, and it's humbling to hear what they've gone through and what they've overcome in many cases. But it's rewarding to me to to help empower them, to give them that voice, or actually I'm not giving them anything, helping them to make their voice be heard, I guess, because I mean they have the power to do it themselves. I'm not giving them anything. I'm just helping them along the way. But it's an amazing gift to be able to see these folks come in and affect positive change for other people that they will never meet. I mean, I guess that's probably the most rewarding thing for me too, is to know that all the work that I do in the two states that I work in, that people that will never know my name, and that's okay. No, I'm helping to make positive change for them, and that's a great thing, and to change even the most hard-boiled legislators' mind on certain things, to show them that they have the power to affect positive change for other people, that it's the greatest feeling in the world. So I don't have one in particular, but it's just I guess it's a thank you to all those people that have helped make this state a better place, and to help folks going through some of the most god-awful situations with cancer, helping to make it a little easier.
Well, thank you for sharing that, and thank you both for being here. And we've shared so much great information with people today, and I think it will be really beneficial for people to hear and learn about American Cancer Society, because sometimes you see these big organizations, but you don't really know the day-to-day, what they're doing and how they're having an impact. And from what you've told me, American Cancer Society and the Cancer Action Network are having a huge impact in New Hampshire and nationally. So thank you for all the work that you do and for sharing a little of your time with us.
Thank you.
Thank you for having us.
All right. I hope that you enjoyed this episode and learned a lot more about the American Cancer Society. I know that I now know a lot more about them and the work that they're doing than when I went into it. And I hope that it has inspired you to maybe get involved with a walk or check out your state, what's going on in your legislature, and maybe how you can get involved that way. If you're a cancer patient, maybe share your story and have an impact on legislation and what's going on in your state. There's so many ways that you can get involved. As Michelle said, they'll work with you to meet you where you're at and make volunteering a positive opportunity for you. So I hope that you will look into that and leave me your feedback about the episode, either by leaving a rating and review on Spotify and Apple, or leaving a comment on the YouTube version. And be sure to follow Dose of Good Podcast on Instagram and Facebook for all the latest information about the podcast. And I will talk to you soon.